Welcome to Ace of Pentacles, your career strategy and workplace wellness podcast. I'm your host, Sara, and I'm so happy you're here. Join me every week as we investigate how people design and discover their way through their careers. Together, we'll explore the science of well-being at work and discover tools and strategies to help us do well and be well. Hi, Dorthy. Welcome to Ace of Pentacles.
Hi, Sara. Thank you for inviting me.
Dorthy, I'm so happy you're here. I invited you here today to chat about a topic that I know people are very curious about. People might be a little bit scared of. um,
Sometimes.
Sometimes, yeah. It's a topic that it's a tool that I use in my practice, which you helped me learn how to use. And you're my favorite kind of go-to person to talk about it with. So let's talk about hypnotherapy.
Okay.
Dorthy, you are a medical hypnotherapist. You
I
are the
am.
director and lead faculty at the Palo Alto School of Hypnotherapy. It's where I got certified. You have been my mentor through the LIGHT program at UC San Diego, and you also teach a course at UC San Diego. So let's start off with, how do you get to become a hypnotherapist? Tell us about your career. How did you get to where you are?
It's a good question, and it certainly wasn't planned. And I'm guessing that most people, when they find this field of study, would say they never planned it. But I was doing some other work at the time, and doing workshops and seminars and things like that. And I'd always been interested in hypnosis, but I never had any inclination to further study, because when I had done that, I could find no universities or colleges who taught it. And one day across my desk, uh, there's a flyer from the Palo Alto School of Hypnotherapy. This was in, I think, like 1985 or 6. And I had no idea where it came from. It didn't come in the mail. There was no client, to my knowledge, who left it on my desk. and and our secretary at the time had no clue where it came from. And so um, I read it. It talked about hypnotherapy, and and gave a phone number and so on. So I called this person, and this woman answered, and I talked to her for a few minutes, and she said, "Well, you missed my introductory evening, but if you'd like to come to the first class and just monitor, just sit in on it and see what you think." And I did, and I never left. So, so I always say I have no clue what got me here, but it was the right thing at the right time. And once I started taking the classes, it became more and more interesting with each class. And then after I'd taken the classes and the woman was Josie Hadley, and she was the founder of the Palo Alto School of Hypnotherapy and started it in 1977. But after a bit of time, the two of us created the medical hypnotherapy course, and so I started teaching about 2 or 3 years after I was certified.
Hmm. Wow.
So that's how I got into it,
Mhm.
and it is so intriguing to me. The mind-body connection is so intriguing to me that uh, I just keep studying, and I never stop studying.
Yes. Yes, because I believe the UC San Diego uh, opportunity is a more recent kind of evolution of this journey on that you're on.
It is indeed. It is indeed. And I'm very excited about that because it's UC San Diego School of Medicine and Centers for Integrative Health. And bringing a hypnotherapy course into that setting to me is one of my dreams, because I've always been, what's the word I want to use? Interested in bringing into that setting, and I would love to see it go into medical schools per se for their curriculums, because it helps. I think it would help doctors, nurses, and so on learn how to speak to their patients in a different way, and to understand that every patient is in a hypnotic state when that doctor is speaking to them.
Hmm.
Yeah. And they take the doctor's word as an order.
Hmm.
And how many people have died because they followed the doctor's orders?
Yeah,
Yeah.
absolutely. I think one of the things that was an unexpected kind of outcome of my own education with you was like I'm very aware of my own language and the way that I speak now. And I think I've always been kind of aware of that, but now I'm like so aware of the way that not just the words that I use, but the way that I structure my questions and my requests of other people. Yeah.
Yes, yes. And not only that, you develop a way of speaking that you have a curiosity about someone.
Hmm.
Yeah.
Yeah. So, Dorothy, for our audience who is like, what the heck are they talking about? What can you help us just understand what is hypnosis? What is hypnotherapy? And what are some cases or situations in which one might consider using it?
What is hypnotherapy? Well, it's really hypnosis as a therapeutic intervention. And hypnosis is a word that was coined in the 1600s, I think, or the 1700s by a man named James Braid. And it's just a word. But for a lot of people, that word has meanings that are concerning. And it's just a word. And what it really is, what hypnosis really is, if we look at it from more of a scientific point of view, all it is a brainwave pattern. And it's the same being in a state of hypnosis, you are producing the same brainwave patterns you would produce when you're meditating or when you're dreaming at night. Isn't some strange occultish kind of thing where someone has power over you? It is utilizing your own mind, your own brain. And there was a man named Aristotle, uh, more than a few centuries ago, who said this. His doctrine was this: that a vivid imagination compels the body to obey it, for it is a natural principle of movement. But the fact is that when we're thinking a thought using our creative imagination, we are producing physiological slash emotional responses within us. And that's just a fact. How many people can think about uh, peeling a lemon, and then once that's peeled, smelling the fragrance of the lemon, and then once that's peeled, breaking it into segments. And how many people can imagine that, and then thinking about picking up two or three of those segments, putting them in your mouth, holding those segments on your tongue for a moment, and now chewing them? Most people are going to salivate,
Hmm.
and all it is a thought. It's an imagining, if you will. That, and I've done this, I don't know how many thousands of times. I still salivate when I do it. And so here's a thought that's causing the salivary glands to function. And most people will salivate, or they will pucker. You know, that their mouth will almost go dry. It's still the same functioning that is producing a physiological response, that thought. And so hypnosis is, in essence, a way to help us be in control of what's going on inside us. And we do use a vivid imagination to do that. So all hypnosis really is doing is helping us change our perceptions. If I have a bad habit, let's say I have a habit of nail biting, and I want to stop because now I'm 40 and I did that since I was, 3, and because I had to wait till I had teeth, and and so and now I'm 40 and someone comes to see me and says, I want to stop biting my nails. And I will talk to them about that, and it's just an old habit. And not only that, they've convinced themselves they bite their nails because they think it all the time. Oh, I wish I could stop biting my nails. I'm biting my nails again. And so our mind talk, what we say to ourselves over and over and over again, is like self-hypnosis. We are convincing ourselves over and over and over again that this is who I am. And so how do we change a habit if my perception of myself is as a nail biter, for example, and how do I stop when I've convinced myself that that's who I am? And so a hypnotic session would help someone begin to change their perception of who they are. Now, I'm using a relatively um, common behavior, but let's say my doctor has said that I have a catastrophic illness and I only have 6 months to live. If that's my perception, he'll get to be right. But can I change my perception? Can I change my perception to someone who is a fighter? Can I change my perception to someone who knows that my body is programmed to heal? And when someone is working with me, my job in essence is to help them change their perception of what they've always believed to something that is more beneficial. If I'm going to believe something, let me believe something that's beneficial. Yeah.
Yeah,
Does that answer your question?
it does. It does. Thank you for sharing those specific examples of situations in which one might want to use hypnosis or hypnotherapy. One of the things that I've used hypnotherapy for, and you actually helped me with this, and I tell people about this, and they're like, "Does that like really work? Like, what did it really work?" And it did. It was around my confidence. Um, you did this beautiful, beautiful um, visualization exercise with me that basically just helped me see myself as someone who was confident enough to do something that I had not done before. So in that way, I changed my perception of myself. Can you tell us what are some of the situations where people would be like, I don't think hypnosis is for that, but it actually does work? What are some examples of that?
Oh, there are so many.
Yeah.
I've helped people be a better golfer. People have come to see me because they have been diagnosed with catastrophic illnesses. And people have come to see me because they want to stop smoking, or they want to get healthier and eat differently or exercise differently. People have come to see me because they have extreme phobias and cannot do certain things under certain circumstances. People have come to see me because they have OCD. Uh, you know, almost any issue, a human issue, can be helped with hypnosis and or eliminated with hypnosis. Because why? Because what we're really doing with hypnosis is depending on the neuroplasticity of the brain. So when I say that, it just means that our brains can change. And let me say that 30 or 40 years ago, science knew that the brain could not change, that cells did not regenerate. They knew that until they didn't, until it was proven that that was just not so. And that's what I love about science is that just because we believe something is so scientifically doesn't make it true.
Mm.
Because there was a time when everyone knew that the earth was flat. They knew that because scientifically they had proof
Mm.
until they didn't. It's the same thing with our human nature. People will say, well, no, I'm just a worrier. I just worry, and that's just who I am. My mother worried, and I worry, and her mother before her, we're just a worrying family. And Sara, when people say that, it is simply because they have already convinced themselves that that's true. Except here's the problem. Worrying in that way produces anxiety, produces stress. And when that occurs, it changes our chemistry, our internal chemistry. And then people wonder why they age so quickly, or people wonder why they have high blood pressure or heart problems or IBS or whatever else it is. And so someone might come to see someone like me to find out that they can change what they believe about themselves, and they can change their behavior, and they can change how they respond to the world rather than react to it.
Mm.
It's a big difference, isn't there?
Big difference.
Big difference.
Yeah. Respond to the world rather than react to it.
Yeah. So truly, I doubt there's any human issue,
Mm.
mental, physical, emotional, that can't be helped with hypnosis. And all hypnosis is doing is offering suggestions and allowing people to in the imagery that we provide while they're in a hypnotic state, in that imagery, they literally are taking action. They're literally doing something, even though it's imagined. If my imagination can cause my salivary glands to function, then then my imagination can cause many other things to happen that are beneficial to me.
Mm-hmm.
And so when if someone wants to change, and quite frankly, hypnotherapy isn't intended for people who don't want to change. There's no point. But in the hypnotic state, people are imagining that they're doing certain things, and then the subconscious mind accepts that as reality, as truth, as intention.
Mm. Yeah. Dorothy, there's this, I think there's a belief sometimes that people hold that if you're being hypnotized, you are not in control
Yeah.
of your mind. Can you speak a little bit to
I
that?
definitely can do that, yes. And I'll go back again to say that when you are in a hypnotic state, when the hypnotist has asked you to close your eyes and begin to relax, and just begin to think about relaxing all of the muscles in your body, from the top of your head to the tips of your toes. And then the hypnotherapist will continue to talk about how your body is relaxing, and then might suggest that you're standing at the top of a staircase and you're going to take each step down. Each step causes you to go deeper and deeper, and so at a certain point, if you're my client, you are very, very relaxed and listening. And then your conscious mind is not so involved, but more the subconscious is taking in the suggestions. Now, if I say something that is something that you would not do, for example, if I said while you're in that hypnotic state, and now you you are going to, I don't know, um, scream
Mhm.
when I count to 3 because there's a tiger facing you. Now, right there, your conscious thinking mind might say to you, well, I don't want to do that. And I don't want a tiger here. I'm right here. And now you bring yourself out of that trance to a certain degree, and I can give you that suggestion, but you won't do it.
Mhm.
But if I give you the suggestion that um, you find yourself in a beautiful place that is yours and yours alone, and it's like a healing sanctuary. And in this healing sanctuary, you feel all of the beautiful energy and light all around you. Now, if that's something that you would like to do, then you'll do that. But no one has power over anyone in a hypnotherapy session. Can some people be hypnotized and accept ridiculous suggestions from the hypnotist? Yes. But I promise you, they're accepting them because they have agreed to.
Yeah.
And so hypnotherapy is simply a way of helping someone, or if I'm the subject, it's a way of me helping myself become stronger and to handle situations very differently than I used to.
Hmm.
I think in terms of how I was in the past, how I did things in the past, my habits from the past are of the past. And so with hypnotherapy, who am I today? How do I want things to be today?
Yeah.
And hypnotherapy can help that happen. And no, you are never under the power of the hypnotherapist. You're just hearing what the hypnotherapist is suggesting, and you will follow those suggestions when they are meant to empower you in some way.
Right.
Does that make sense?
It does. I think one of the ways that I explain that to my clients is the experience you're having is your experience. I'm here to facilitate that experience, but the
Mhm.
experience you are creating for yourself is being created by you.
Exactly.
Right. That actually leads me to another question that I'd like to have you speak to. So when we work on issues in hypnotherapy sessions with my clients, I help folks with things like confidence, right? Getting over a fear of public speaking, stop procrastinating, right? All these sessions start with an intention, and this goes back to what you were saying about you have agreed to it. If you're doing something post the hypnotherapy session, if there's something that's being given to you and you're altering your behavior, it's because you've agreed to it. And so that starts with an intention. And Dorothy, I love the way that you speak about setting an intention and all the steps involved and like how you can actually do it really well. Can you speak a little bit to that?
I can speak more than a little bit, Sarah.
Okay, great. Perfect.
Uh, for me, uh, when a client first comes in to see me, I'm going to interview that person for a little while, an hour, maybe a half hour. But one of the things I'm going to talk about is their intention for the session or sessions, depending upon how many we decide might be appropriate. Uh, I'm and if you were my client, I would say to you, tell me what your intention is for this session. Now, let's say you want to, I don't know, uh, let's go back to biting your nails.
Hmm.
And not that you do, but let's go back to that because we started with it. And so I would say, so tell me what it is. What's your intention about your nails? And you might say something like, well, I want to stop biting them. And then I will say, well, I understand that, but let's take that verbiage out. I want to stop biting them. So let's say, if rather than stop biting them, what is it I want to have happen? What is I want to do rather than bite my nails? What is I want to do? And you might say, well, I never thought about it that way. How many times I've heard that. And I'll say, well, think about it for a moment. What is it you want to do with your hands? Oh, well, I want to keep my hands in my lap and I want to keep my hands away from my face. That makes sense. Yeah. And then might also find out the where, when, and the why of in the past of when you were biting your nails, what caused that to happen. And in some of those questions, then I will find out many things, and so will you. Because I will ask the questions that cause you to become enlightened about your habit.
Mm.
And then we might come to the conclusion that when you're biting your nails, there are certain feelings that are occurring before your fingers go into your mouth.
Hmm.
Hmm. And so we'll deal with that but finding out the intention and then I will say, so let me see if I have this. You always want your hands away from your mouth, unless you're eating, of course. But you want your hands in your lap, or maybe utilizing them to speak, or perhaps just finding them very comfortable wherever they are, by your sides, on the arms of a chair. Is that correct? And you say yes. And I say, what's it like? Just just imagine that everything is absolutely perfect now. Everything's been done that needs to be done about this, and you are now 100% of the time someone whose hands are free to utilize in so many ways, and or perhaps just rest. And if everything is done, what's that like mentally when your hands are free to just relax? And then I will say, and what's that like physically when your hands are just free to relax? And what's that like emotionally? And you're going to tell me what that's like. And then I will say, so now it's already done. Your hands are free to relax and you're free to let them relax. And you said that physically it's this, mentally it's this, emotionally it's this. and just close your eyes for a moment and be that, and tell me, is this your intention? And I've yet to hear somebody say, no. It's invariably, yes, this is exactly.
Mm.
Now they know in that moment, that person knows exactly their destination. They know exactly their end result experience.
Yeah. Mm.
So that's intention.
Thank you, Dorothy. Can I share something that this happens a lot with us. This happens, and I'm sure it happens all the time with you, actually, with anyone. But I've when I was very young, I used to bite my nails, and
Okay.
I stopped biting my nails at about 16, I think.
Mhm.
And I haven't, and I'm almost 40, and I haven't bitten my nails for a very long time. And just this past weekend, I was on the plane and I was nervous about something, so I start biting my nails.
Mm.
And it's funny that that's the example you threw out there at the beginning of this call. That's what's so
No
funny about it.
surprise.
Yeah, I'm not surprised either. So I start biting my nails and I actually did self-hypnosis to get myself to stop because I got to one hand, the end of one hand, and I was like, oh my gosh, I'm just gonna start biting my fingers off at this point. And so I was like, oh wait. And I actually used self-hypnosis to get me to like relax and calm down and like keep my hands still.
Mhm.
Yeah.
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 And since then, have you found yourself doing any nail biting?
No.
No, because you made a decision,
Mm.
and that decision for you, Sara, was so important. And when you did that, you changed your perception,
Mm. Yeah, and you knew about it because
right?
you just brought you just magically knew because you brought it up at this
And
very
that's
call.
and that's what I refer to as intuition. I don't know that I'm
Uh-huh.
doing that, but after the fact, clients will say that very thing. Oh my God, Dorothy, you just hit it. I didn't even tell you.
Yeah.
And it isn't that I'm intending to do that,
Hmm.
but but a thought will come,
Hmm.
and then I'll just go with that, whether that's a private session or an interview like this.
Yeah.
And I depend on that.
Hmm. Yeah. I think as, you explained this really well once to me where I remember when I started doing hypnotherapy, that would happen to me where I would say something and then afterwards the client would be like, "How did you know?" And I came to you and I was like, "Dorothy, like I'm almost afraid to like say anything anymore because like what if I'm scaring them?" And you were like, "No." You were like you're like you have to like rely on that. You have to trust that. That's your intuition. Yeah.
That's exactly right. It isn't strange or unusual. We all are intuitive, because why? Because we're energy,
Mm.
and when two people are in the same room, then those two energies, when you start talking, those two energies sort of meld and commingle, if you will. And so people are talking the same language. How many you probably have a best friend or two, and you know that you might be in a room and things might be going on and something happens. The two of you look at each other and have a conversation across the room without saying words, but each of you know what the other is thinking.
Yeah.
That's intuition.
Yeah.
I depend on it.
Yeah, I think it's a very powerful thing to be able to do that as a hypnotherapist for your clients because I know that it's never been awkward when that happens. It's always just kind of like the way I just did it right now, like, oh my gosh, this is magical, right? My clients will be like, oh my gosh, like, how did you know that? That's so cool. And like, but I very much remember that first conversation. I was like, Dorothy, am I doing something wrong? Because it is scary when you realize how present it is.
And I also think, Sara, that when you are working with other people all the time, when you're doing sessions, when you're interacting, when you're interviewing, it becomes stronger and stronger.
Yeah.
It's just a natural happening,
Yeah.
I think.
I agree with that. I think so
Yeah.
too. Yeah. Dorothy, can you talk a little bit about what is medical hypnosis or medical hypnotherapy?
Well, my course, medical hypnotherapy, uh, is more directed at medical situations. And what I want a hypnotherapist to be able to do is to go into a hospital setting with a client, a patient, a friend, a relative, and be able to help that person relax, to be able to help that person get into a relaxed state. For example, if anyone has surgery or is told they have to have surgery, they go into anxiety almost immediately, the average person. And what I know for a fact is that the more anxious someone is, the more anesthesia has to be used. And so if I'm very comfortable and relaxed, less anesthesia is used. And anesthesia is a chemical. And I was told one time that after a surgery, uh, it takes almost a year for that anesthesia to fully be what's the word I want? Released from the body. And so, also, so many things that are medically related can um, can be helped with hypnosis and visualization. I had a friend who was lots of years ago now, but she was diagnosed with lung cancer, and her doctor told her that she had about 5 weeks to live and that she had to get her affairs in order immediately. Well, imagine hearing that from a doctor. And so she called me and told me what was happening. And it's a long story, but to shorten it up, I said, did the doctor tell you about any cases of remission? She said, what do you mean? Well, I said, did the doctor give you any information about people who had gone into full remission from this? She said, no. I said, let me get you a couple of cases that you can read about. And I did. So I said, so tell me this, which do you prefer? To follow the doctor's orders or to go down the path of people who can go into remission? Well, I won't tell you the words she used, but in essence, she said, I'd rather go down the path of people who can go into remission. And it was a journey for her, but she didn't die in 5 weeks. It was almost 20 years later, and she had no cancer in her body. Now, do I take credit for that? Not at all. But I will say that she gave me credit for it, but I didn't do anything. I only knew the words to say. What she was doing in her mind with her body and how she saw her body healing and so on and so on and so on. So medical hypnotherapy is simply addressing medical situations and helping people uh, take back their own power when it comes to their health and wellness.
Oh, what a beautiful story. Thank you for sharing that.
You're welcome.
I do think that hypnosis is one of the most empowering tools that you can use that we have access to. Um, Dorothy, I want to talk a little bit about can you tell us what is regression hypnosis? You've done a past life regression on me, and people have different beliefs about, whether we've lived other lives. And I grew up not believing in past lives. And then I had a past life regression with you, and I was like, oh no. This is this is something that I can't explain with my brain.
Exactly.
Yeah.
Yeah. Yeah.
So, yeah, can you talk a little bit about regression hypnosis,
I
what it
I
is?
can. Yeah. Regression hypnotherapy or hypnosis isn't always just about past lives.
Mhm,
It can be regression in this lifetime,
mm,
this life called me, and perhaps someplace in the distant past, I I lived somewhere and I'd totally forgotten about where that was when I was little, and I think my grandmother, I think I knew my grandmother. Uh, I sort of remember her, but not quite. I can do regression therapy from maybe somebody's 40. And if that someone is 40, I can do regression therapy and take them back to when they were 3 in that house when grandmother was there. And they will have, is it an absolute second by second um experience? Sometimes, and sometimes it is more a sense of what's going on. But memories will come in that instance. And so there's a thing called forensic hypnosis, which is a hypnotherapist working with someone perhaps who saw a crime,
mm,
and it was so shocking that they can't remember, they can't describe the criminal, or they can't describe what was going on. But hypnotherapy can take them back to that moment so that they can see the person, or see a license plate as a car is driving away, because they saw it.
mhm,
And trauma will disallow them from remembering it, but in the hypnotic state, now they can see it again.
mm,
Yeah. And then past life regression is taking people back to another existence on this planet. And is everyone open to the possibility of past lives? No. And so those people are not going to come to see you
mhm,
for a past life regression. But people who are open to that possibility uh, are curious. And um, there are so many situations now, especially with children, who
mm,
are remembering past lives. Now, let me say this, that it isn't that is uh, uh, currently more prevalent. It is that we now have so much information and sources of information that we hear more about it.
mhm,
But these stories have been going on, since I don't even know how long. But sometimes looking at past lives gives us insight into who we are now, and why we're doing what we're doing, and why I married him instead of him.
mm,
know.
yeah,
So there are lessons in life that sometimes we can learn more about by perhaps exploring the possibility of a past existence.
yeah. Yeah, I thought it was a very cool experience. It actually, for me, it really just helped me gain perspective on a few things that are happening to me currently
Yeah.
and things that I've gone through more recently.
Yeah. It at least gives you some ideas and some possibilities
Mhm.
where you had no clue prior to that, or you felt like a victim.
Yeah.
Yeah.
Yeah. I actually think it's something that could be really great for also people who, there some people are just very afraid of death. And because it's like the most unexpected, like what is it even? What does it feel like, right? And we don't know, and that can cause a lot of anxiety, especially for people who are at that point in their lives
That's
or have
exactly
been
right.
told that they're reaching that point. Um, so I think it can be a very powerful thing, a very empowering exercise to take someone through that.
That's very true. I've had people say that to me. I I I worked with a young woman who had been diagnosed with HIV. This is quite a few years ago. And her sister called and asked if I would work with her because she had so much anxiety about death. She was 21 years old, and she contracted it through a blood transfusion, and it went into full blown HIV, and uh, and she was like 2 weeks from death, truly. And her sister carried her into my office. And this young woman was probably 5'8", and the patient,
Mm,
and literally skin and bones.
mm,
And I she didn't come there to um, heal physically, but more to heal emotionally. And she was too I when I do a past life regression session, I I try to do 3 past lives and also to have the death experience in each lifetime. And so she was too weak to do 3, but she did do 2. And in each case, she felt victimized, and she felt like she was being punished with this disease. And the fact was, the 2 past lifetimes she went into were past lifetimes where she was caring for people who were dying. And one was the plague in Europe. Uh, how many centuries ago was that? Caring for them to their death. In 2 instances, she was doing that, and all of the people around her who were caring for her were the families and the people that she cared for to their death in past lives.
mm,
And she said, I don't understand. I'm not being punished. I said, no, you're not being punished. You, and only an old soul would do this. You came back into this lifetime to allow people that you had cared for to do the same for you. Only an old soul would do that. And she had tears. She said, oh, I now I understand. She said, I never came into this lifetime to live a long time, because she had that insight. And she said, and now I'm not afraid of death because there is no death. Because in both cases where I took her to her death experience, she just went into the light.
mm.
And she said, oh, there's nothing to death. There is no such thing. Just my body will stop. And so when I tell that story, I have to say that this is the first time I've told that story without choking up and tearing up. Because, and I've told that story so many times. That story, I will say to you, is probably one of the main reasons I do the work I do.
Mm.
Because it shifted everything for her.
Yeah. Dorothy, thank you so much for sharing that.
You're welcome.
Mm. I'm very glad that you do what you do. So thank you.
And thank you for saying that. And I'm glad I do what I do as well. I think that once I became a hypnotherapist, I began to see the, you know, the reason that any of us are on this planet is really to be in service and to help other people. Now, I do it this way. Other people do it other ways, but it's when we feel, I think, and I can only speak for myself, but it's when we feel more fulfilled. It's like we're making a difference.
Yeah.
Yeah, like the work that you do, Sara, is making a difference in the lives of other people.
Yeah, I think so, and I'm so thankful that I get to do it.
Yes.
Yeah. Dorothy, such a wonderful conversation. As we wrap up, if there are folks who are listening and watching and who are interested in learning more about hypnotherapy, can you give us some ideas for how they might get started?
Yes, they, by all means, they can certainly look at my website,
Which
which is,
I'll
which
put in
is,
the show notes.
thank you, and also to go to UC San Diego's website and look for the hypnotherapy course. They can find out more about that there. There are lots of books one can read about hypnosis. One can go on YouTube
Mhm.
and look for scientific information for hypnosis and become even more educated that way.
All
There are
right.
so many ways to find out more about it, and I'm always happy to have a conversation with someone who's interested in knowing more about it or becoming a hypnotherapist.
Yeah. Well, Dorothy, thank you so much. Dorthy Tyo from the Palo Alto School of Hypnotherapy and UC San Diego. You're an instructor there as well. I will drop your information in the show notes. So if people have questions, they can reach out, or if they're interested in taking courses. The Palo Alto School of Hypnotherapy offers a lot of courses. Are you still offering the intuitive development course as well?
Yes, I am.
Yeah.
Yeah, and you don't necessarily have to be a hypnotherapist to take that. You could be any kind of therapist, or people, or someone who is working with other people.
Hmm.
It isn't for people who want to become a psychic.
Yeah.
That's not what it's for.
Yeah. All right. Well, thank you again for your time, for sharing your expertise. It was so wonderful chatting with you.
Thank you, Sarah, for inviting me. This was a lovely conversation, and you are a very lovely person.
Thank you, Dorothy. I think you are too.
Thank you.